and welcome to NAP's Sponsorship Spotlight interview. I'm Jody Frost, president of NAP, and today had the pleasure of interviewing Dr. Laura Ramito and Dr. April Newton from Indiana University. These spotlight interviews are designed to provide our members with an opportunity to learn more about our sponsors and the many opportunities you have as a NAP members to seek out information, resources, and opportunities to connect with them in the future. We'll begin our interview today with Dr. Laura Ramito, who is the professor at Indiana University in the School of Dentistry and also serves as the Assistant Dean of Faculty Development and Engagement, and Dr. April Newton, who is also a physical therapist and Director of Interprofessional Practice Development. So we'd like to learn more about your interprofessional education and collaborative practice at Indiana University. Dr. Ramito and Dr. Newton will be responding to two questions to enable our members to learn more about the remarkable interprofessional practice and education being undertaken at Indiana University. So good morning to both of you, our guests, and let's begin with the first question, if we can, for both of you to respond. Taking into account the changes across healthcare and healthcare education, where do you see opportunities to partner with NAP to advocate for affordable, accessible, coordinated quality healthcare for all?
April?
Sure. One area that we're really focused on at IU is through our collaborative efforts is really looking at a lot of the different policy changes that are going on pretty much respective of reimbursement and healthcare and looking at how we would be able to coordinate with NAP. And for me, I sit on the policy committee to be able to look at opportunities with telehealth. That's an area that I've been working on in my clinical role with practice development in developing telehealth opportunities for the 4 different team-based care clinics that we currently have, and 2 of them are up and running. We have a comprehensive pain assessment clinic that is hybrid, it's telehealth and it's face-to-face, and we're beginning to look at some research data as we continue through this next year to be able to determine how that's working with the 2 different models, if you will. And the other one is a transitions in care model where our residents, and we also have other providers come together when our patients are being discharged from the hospital. And again, this is a mixed model with telehealth and with face-to-face. And these patients are accessing via the telehealth and or they're coming into the clinic. And again, we're trying to reduce any problems that are happening with that transition. For instance, making sure that they're understanding what their medications are and getting the right referrals and having the right phone contact. So in the clinical realm, I think that's important because with reimbursement with telehealth and also looking at opportunities for team-based care to be covered in a way where every provider has an opportunity to bill. We're going to have to look at that not only at a state level, but at a national level. And I definitely feel like NAP has that opportunity to work with a lot of institutions and a lot of institutions that have tertiary care centers like IU to be able to determine what are some of the next steps.
Thank you. April. Laura, would you like to comment?
Yeah, I think April gave some excellent examples of what we're doing here at IU that support and advance the goals of NAP. I think one of the things that she alluded to was the fact that, you know, we have people who are very closely aligned to the work of NAP, and it really boils down to the members, to people. We have faculty members here at Indiana University who are very engaged in interprofessional collaborative work, be it teaching, practice, research, and having those individuals connected to NAP is one way that we can support your work. So part of it is really increasing the awareness about NAP and its goals and its mission. I think that's really important to do in the academic community. I know from the Dentistry Academy, we have had a situation where many of our membership has really been from the practice community, which is great. But I think opening up the eyes of the academic community as well, who often partner with practicing community, can really be helpful to increase awareness about what NAP is doing, but also increase membership and active and engaged membership in the organization. So I think that enhances the ability of institutions like IU to work with organizations like NAP. And also sponsoring activities and events that NAP is involved in, because again, it really boils down to the people.
Any other comment on this question, April?
Sure. I know I spoke more on the health role. I'll give you an example of the healthcare education role that you ask about in respect to NAP. Because we have a number of faculty members who are in different NAP academies, and also, unfortunately, because we're in a pandemic, we've recognized across our academies and across our institutions how we can actually access each other virtually and have opportunities for education for our students with disciplines that we currently don't have at IU, and they may currently not have and we have. So NAP is really giving us a really strong opportunity to really force some new initiatives to the forefront with interprofessional collaborative practice and interprofessional education that I'm not sure if we'd have really thought about if we wouldn't have had the specific circumstances that we're currently living with.
Well, thank you both for the answer to that question. And it appears that there's a lot of synergies between Indiana University and your healthcare system and NAP, and I synergies, I would say, that would go both ways for us. And we certainly appreciate that. Let me pose our second question, if I might. So what role does interprofessional education, interprofessional collaborative practice, and interprofessional research have within your institution or within Indiana University?
Well, I think, you know, if you think about what's happening across the university, we're really preparing learners to work collaboratively across the professions and systems and sectors so that when they graduate, they'll be really ready for collaborative practice. And part of the reason we do this is it's part of the university's strategic plan. So it is fundamental to what we do. And it is also something that our center, our Interprofessional Practice and Education Center, is obviously very heavily involved in, because we're a coordinating body for a lot of the interprofessional education and practice efforts across the university system. One of the ways that we've been doing this for the last several years is we've developed and implemented a sequenced competency-based curriculum, a foundational curriculum, if you will, across our health sciences schools and programs across 9 campuses across our state. And the goal of our curriculum is to help teach the skills that are required for effective communication across professions and effective collaborative practice, so that our graduates will have those skills when they enter the workforce. And the curriculum itself has several different components to it. So it's a longitudinal curriculum, and it includes both introductory, simulation, and clinical practice or professional setting type of experiences. So that's one of the ways that we've really spent quite a bit of time and effort in trying to infuse the concept of interprofessional education and practice across the university system. With regards to practice, I'll let April comment on that, because that's really her area that she has been most familiar with and building over the last several years. April?
Thank you.
Sure. And Laura, I'm going to come back to you and you'll know why, because as the PI of our Grand Challenge grant, I want you to speak a little bit more about that, but I'm going to bring it together. So one thing that I was really thinking about in the last week or so, how we really have not one pandemic that is in play right now in not only our United States, but in the world. I'm really thinking we have 3. And Indiana University is very intertwined with all 3 of them. Obviously, we have the coronavirus 19 pandemic. we also have an opioid pandemic. Others may say an epidemic because it's here in America, but we're seeing literature from all across the world where we have the opioid pandemic is vital and vibrant. Unfortunately, that in Indiana, we're in the top threshold of that particular epidemic in America, and really trying to work hard on mitigating that with a lot of the research that we're doing at IU, as well as some of our practices that we're developing. The third one, it's much more silent, and that's our mental health care epidemic, if you will, which I think too, we could say it's a pandemic. So when we have the three of those coming together, what that has afforded us, not only at IU, but really across the spectrum, is the opportunity for interprofessional collaborative practice. And what we are doing with our students through interprofessional education and collaborative practice, we're really trying to hone their skill sets with that foundational knowledge with interprofessional education with our TEACH program that Laura just articulated well, and moving them into interprofessional collaborative practice opportunities, which I have the opportunity to be able to work with our students in team-based clinics. And currently, as I mentioned earlier, we have a pain assessment clinic, we have a transitions and care clinic, we have a team-based clinic, and we also have the opportunity of our IU students having our student outreach clinic. So we're really embedding them as much as we can into these other outlets so that they can get an idea of how they're treating patients that are having a chronic conditions, but with a mental health prognosis or diagnosis as well. And then we also have the opioid epidemic that many of our students are being able to see through our pain assessment clinic. So there have been lots of opportunities, not only at IU, but throughout Indiana. Because of our 9 campuses throughout the state of Indiana, we're able to work as a hub in Indianapolis through our Indiana University, Purdue University campus, and then target our other sites, and again, through telehealth. This is something that would not have been happening last year, and how we've been able to forge that opportunity with multiple different campuses, as well as the different students on those campuses. So what I'm going to do is ask Laura to talk a little bit more about our Grand Challenge, which is really funded at least the pain assessment clinic component and a number of research opportunities that we're currently undergoing.
Yeah, I'm glad you mentioned that, April, because I was going to comment on research too. That's what Jody was asking about as well. And we've talked about education and practice a little bit. And of course, interprofessional research has always been encouraged at IU, having researchers from different disciplines working together on various problems of interest. But at our center, of course, we do encourage research specifically related to interprofessional education and practice endeavors. And what works well, not only in the educational frame or the environment, but also in terms of instructional design, assessment, and of course, patient outcomes. So one of the things that we were interested in and became involved in is the addictions situation. As April mentioned, it's not, and I would also say addictions, generally speaking, we talk about opioid, but I'm always the advocate for tobacco use and dependence, and the fact that that needs to be addressed, because Indiana is one of those states that tends to have higher tobacco use and dependence as well. But we were fortunate to be part of the University Grand Challenge grant program, and we were able to receive this wonderful award. And as you know, as a person who's been involved in this now for several years, we can start to really see some of the elements of the program start to come to fruition and start to have outcomes data, which is what April was alluding to. So our project has multiple different arms. And part of that is educating our graduates on, and especially our practicing graduates and those who would be writing prescriptions and treating patients in this manner. And so we're working to provide education to them across not only their professional program, but interprofessionally. on the situation, on this particular very complex topic of addictions, which actually, many different professions touch and can relate to in terms of healthcare outcomes. So we provided workshops. We've worked with programs to understand the curricula of those programs, do a curriculum inventory, and try to identify gaps in their curriculum with regards to opioid education, pain management, and addictions, and help fill those gaps. And then, as I said, provide interprofessional workshops that enable the students to not only learn about the situation, but work collaboratively together as they learn about it. And so that's been one arm of it. The practice piece, April has alluded to as well, and it's allowed us to have clinics that are interprofessional in nature, team-based clinics that are specifically focused on some of these elements related to chronic pain and addiction. And I think that's been a great opportunity for some of our learners who've been able to see and hear the different perspectives from different professionals who've been involved with this. And then, of course, we've also been working with the community. And April, you may want to allude to this a little bit more because you just touched on it. But we've formed a lot of different partnerships, not only within IU, but with other institutions and community-based organizations as well, partnerships that you may not necessarily think about because they're outside of traditional healthcare type of partnerships, with like School of Education, for example. And it's really been, I think, just the tip of the iceberg of what we're trying to do with this program. Mm-hmm. April, did you want to mention some of the community collaborations that you and Alex have been developing?
Sure. And I'll be brief with this because one aspect of education, which is also a professional opportunity for some of our students, as you mentioned, the School of Education, Laura, we've also this summer are planning to include the Police Academy, which is a component of our IU Bloomington campus, and bringing in those learners that are going into the police force through the Police Academy and criminal justice to be part of our current educational experience with the School of Social Work and working with psychology. So we're bridging some of these gaps that we're currently hearing about in our news media and some of the unfortunate situations with injustice and racial disparities and social determinants of health. And really trying to hone in on some different avenues that, as a larger IU community and working with many of our other community organizations, our Department of Healths, our Indiana Rural Health Associations, our Indiana mental health associations, we're bringing in a lot of the experts that are helping us help others. And when I say the others are really what we're focused on, the students and the patients, and looking at those outcomes for the future.
Well, thank you both. That is very exciting in Indiana. I have to tell you, I'm listening to your outreach that you have, the connectivity you have within the institution for practice education research, and the synergies that you're having in the collaboration with that, and your ability to put all that into a context of what are contemporary issues today. As you eloquently said, April, the three perceived pandemic epidemics, but crisis management situations, to say the least, and how they touch so many health professions, whichever one of those you look at. And the other comment you made, which is, had the pandemic not occurred, a lot of the telehealth and the virtual things you're doing today may not have happened. So the vice, the virtue, the ability to see the positive out of a very challenging situation. So I want to thank both you, Dr. Romito and Dr. Newton, for taking your time today to share your information about Indiana University with all of us, and to really help us see all the synergies that are within your institution, as well as the philosophy, the vision, and mission of NAP in terms of the alignment, and how our partnerships really do make sense in a time of a critical role for interprofessional education, collaborative practice, interprofessional research, and obviously the critical issues in healthcare today and policy. We appreciate your institution's ongoing support and sponsorship of the National Academies of Practice and helping us to transform interprofessional healthcare for individuals, communities, and society. Thank you both so much.